Welcome to the Startup Grind.
So very nice to be here. Thank you for having me. I'm Reneta. I'm the founder and CEO of Foodom, and we're providing medically tailored meals for people with chronic conditions, and now we're finally subsidized by health plan.
So how did you get there? Like,
How did they
that
get
because
there?
since I've known you, you talked about it,
Hmm.
but it seemed like it was like a way journey that, like a dream to get that paid
Yeah.
by insurance. So how did that come about?
Yeah. So there's a short version and a long version.
Let's go for the sh long version.
Short version, and then we'll go to the long version.
Oh,
The
okay.
short one is very short. Is as short as the birthday song, the short one. So the short version is that need to be sometimes, ignorance could be a positive thing, is a bliss. Need to be curious and persistent, and then not take no as an answer. There's no such thing as no. No is not yet.
Hmm.
So that's the bottom line of how we got there. And now let's talk about the long version of 5-year version.
So it took you 5 years to.
Well, no, not really. I started Foodom 5 years ago.
Okay.
And when I started Foodom, my thought was to help busy families with chef services, chefs that come to their home and cook food for the family, the kids and everyone. And it went great, but the slight problem was the pandemic that started a few days after we launched our platform. It just shut down the whole world, and people were very stressed. And so what we did, we used the time of the pandemic to refine the product, do some more user studies, still consumer, just simple consumer chef platform. And what I learned during that time is that the people we helped the most are people with some sort of dietary restriction. So obviously people with severe chronic conditions wouldn't, have a chef at their home during the pandemic, but the ones that did have a chef, they either had allergies or they needed to have certain diet that they couldn't get it, just ordering, and they couldn't cook for themselves
Hmm.
for different reasons. They couldn't cook. And once the pandemic, yeah, it's okay, it's a coffee machine. Once the pandemic started to phase out and the world opened up, um, I actually, very shortly after, I met an amazing person, Dr. David Lubarsky. He's the former UC Davis CEO. He moved to New York in the beginning of the year. But when I met him, it was a completely random meeting. And we just ran into each other in this dinner. And he told me, you need to bring this to health. It's really needed. People that have cancer, that, moms that have breast cancer and can't cook for their family because they're going through
Hmm.
treatments and surgeries and therapy, chemotherapy, and other people that have different, health conditions that can cook for themselves. And I was like, well, what are you talking about? Like, I had to study and research a little bit about this, and then he became an informal mentor for Foodom, and he highlighted to me the direction of like where the health system is going, and from transactional healthcare to value-based care. And it's a long, the health system changes very slowly,
Hmm.
especially with federal, funding. So it's not like a year or two. It's like a 10-year, 15, maybe 20-year shift, and we're already like 10 years in. It's not over yet, but everybody know about it and talk about it. So there was maturity for that. It's just very, very slow. And then as I started to learn about this, I was looking for a partner where, we can start a project. So again, thanks to one of our investors, the Growth Factory. Um, so what I did, I basically, when I went to networking events and
Hmm.
to meetings in the Growth Factory or any event, they would always ask, what do you need? So mine was, I want to get approved by a health plan and add FSA, HSA on our platform. And everybody who met me and asked me, what do you need? That's what I need.
Right.
So eventually I found how to do both. So we added FSA and HSA on the platform with a company that does that. They're the back end. We use their APIs to process the payments. And very cool solution. It took me about a year to find them, no, maybe 6 months to find them, and then another good few months to integrate it.
So they were just a company. They were like a company that helps.
Y Combinator company.
They're a Y Combinator company that
yeah.
helps other companies use FSA
Yeah,
and they
implement FSA on their
and it's just APIs?
the APIs. Yeah, of course you need to fit the IRS guidelines, and
Right.
it's not for everything. But once you are, you do find you fit one of the guidelines, then they can help you.
So did you have to have like I mean obviously you can't pay for something I want to say something frivolous, but for your meals did they like
you can pay with your FSA and HSA. So we started with diabetes patients or people that have any type, pre-diabetes, type 1, type 2, pregnancy diabetes, and anything that relates to diabetes. And we added on our platform their API, and it looks like, on Amazon when you go and see, eligible for FSA, HSA, and then you can click and then it takes you through the flow. We use similar user experience, and it's available now on the platform.
Okay, that was easy then.
Yeah.
Well, easier.
That's you don't need to get approved, but there was a process of getting all of this to work, and then they were back then also like early on, just finished their YC, and then things changed. So it's like it's moving parts, just two startups moving at the same time. So that's fine. That definitely was much easier than closing with the health plan. Flex, with flex.com.
WeFlex? With Flex.
With Flex, yeah.
Okay, so for our viewers.
Yeah, reach out to.
So like when they order food from you, is there like a checkbox that says FSA?
Yeah, instead of paying with a credit card, you can check.
And then they just need to have the FSA credit card.
Yeah.
Okay.
Mm-hmm. Yeah.
Wow, that's easy.
Yeah.
Well, it's good that there's a company like them. So.
Yes, yeah, and then very successful company. So very happy that I was introduced to them by some other startup, and then we got this off the ground. So that was one.
So when you got the FSA approval, did you see a difference in an uptick in sales, or do you have to market that, or
you have to market it? Yeah, we did market it, and we 100% market. Yeah.
Okay.
Mm-hmm. You can do ads for that, and also they're providing marketing material, which is very nice. So I use their material to send emails and some language that we incorporated on our site for SEO and yeah.
And by the way, FSA is flexible spending accounts,
and HSA is health spending account. Okay.
So our viewers know, but they probably should know this.
Yeah.
If they're watching it.
Yeah, it's good. It's good that you're sorry. Yeah.
So
that was the first step into health, and that was and that was my thinking of diversifying, of having like employers, an option for employers, to work with them and employees, and then I was looking to get into health plans. Now, health plans it's a different story. It's much more complicated. It takes longer time. So happy to share how the steps I did, and also some of the grind I went through, because it was a grind. So the Growth Factory, back to the meeting with the Growth Factory, we had a table with CEOs, like you mentioned, before we started recording, and each one said what they need, and the other people just said, hey, I can help you with that, I can help with that. So I said, I want to work with a health plan. And one of the mentors there said, I can connect you to an FQHC, which is a federally qualified health center. And their FQHCs are working with Medi-Cal patients, and they're providing them healthcare services. And I said, okay, that's not the health plan, but it's closer. It's a step closer. So I'll take anything. And introduced me to one community health CEO.
One community health CEO.
Yeah.
Okay.
And she really loved the concept, and she's trying to implement as well, value-based care and provide the best care. She has a big heart, and she wants to help medical patients. And they're today servicing 24,000 patients, and they're growing. They're expanding in the next few years. So they have a very, very, significant portion of the population in Sacramento area. And she wants to give them good service and improve their medical outcomes.
So this is a Medi-Cal organization?
This is a Medi-Cal organization. They're a clinic. They're providing health services. So they have doctors, dietitians, they have the full-blown like
What's the name of it again?
One Community Health.
One Community Health. So they mainly service Medi-Cal
Only
patients.
medical patients.
And I figured it's very, I would say niche, but they have probably a lower, like, I don't know, they get less money. I don't know, is that correct?
And I have no idea how that works. They seem like they're doing great. And there are a bunch of FQHCs in Sacramento that we have maybe 4 or 5. WellSpace and Molina, WellSpace, Elica, and SNAC, which is the Native American FQHC. And I think there is another one. So there are a bunch of FQHCs in our area. I learned over time. But back then it was One Community Health, and we were and yeah, so we were thinking, okay, we definitely agreed that we want to do that, and she introduced me to a doctor on her team, Dr. Andy Lackett, that became a medical advisor for Foodom and still with us even after he left One Community Health and joined Sutter. And but back then when he was there, we together, the 3 of us, were trying to figure out how can we fund this. So they love the idea of having chefs prepare meals for their patients and bring also the groceries and do everything at their home and provide cooking lessons.
Okay.
But who pays for that? So initially we were looking for some funding from grants. We applied to get a grant from UC Davis. It didn't work. We weren't approved by the management. The management is responsible on the grants. And then eventually Michelle said, you know what, let's just go straight to the health plans. And she found the contact person in Anthem, which is the biggest health plan in our area, the major one. And then Dr. Luckett from our team reached out. Of course, I'm copied on everything, but it was a doctor from the clinic asking, hey, can we have this service for our patients? And not just ours, to all Medi-Cal patients. And when it came from them, so this long story short, it took a year to figure that one out. And we heard back from them relatively quickly, and they said, hey, this is very interesting. Please fill this form of like applying formally.
Mm-hmm.
We did that. We applied. And from there, it's just the regular grind of working through the process. I was surprised. We finally, I think it was around July that we got the contract to review and the rates last year. So we applied, it was October, November or something, July. So it takes time. And then, of course, I filled all the contracts. And, at early stage, when it's your first health plan, the negotiation power here is completely on the side of the health plan. So you just say thank you.
Right.
And I read everything, and okay, that's what I need to do. We'll do it. And signed all the documents, provided them everything, and then it took another 6 months. In January, they approved. Everything was approved and signed, and then we start training. So only in March we were able to start getting, I think in February probably we started getting the referrals, and then in March the actual orders started to flow. So there is after you're approved, it doesn't mean it's like a switch on. It's like everything takes weeks.
Trickle.
Yeah.
So I think I remember watching I got all these Facebook ads around the same time. Like I thought I saw like Safeway and some other delivery companies. It's like it seemed like I saw like a number of other like food companies also at the same time get say we could support Medi-Cal patients or something like that.
Yeah, medically tailored meals it's known codes on the Medicaid, Medi-Cal side. So we didn't invent the wheel. That's why it was so fast. It took only like a year or so instead of 5 years, because we used existing codes. And so there are companies, Mom's Meals, Meals on Wheels, Performance Kitchen. In our area, we have Burgess Brothers that do medically tailored meals. We have Our Food X that are awesome. Like we're partnering together with them and with our Burgess Brothers. So there are a lot of companies that do meal delivery, medically tailored meals, and then there are produce delivery, so produce prescription. So patients can get approved to get a box of ingredients, and then they cook by themselves.
Okay.
So that's normally the follow-on after the medically tailored.
Is it specifically Medi-Cal that support?
It's all Medi-Cal.
It's all Medi-Cal. So
Those
other,
are, yeah, of course there are other plans.
right, but right now it's just Medi-Cal that is.
That's what, yeah, you need to start somewhere, and the connection I got was there.
Right, but are there other, are you aware of other like Kaiser or?
Oh, yeah. So Kaiser has also, by the way, they have Medi-Cal, they have their own plan, HMO or PPO. So there is like, the Kaiser plan and then the Medi-Cal that they support too, where they get funding from federal. And then Sutter has their own health plan, and they also accept other health plans for the patients that they see. So there are different, there are a lot of commercial health plans, and then the self-insured companies that we discussed earlier too. So this world is huge, and Medicaid or Medi-Cal is one small portion of that, but the rest of the population.
So you're on Anthem Medi-Cal right now.
Yes,
so specifically those two.
Yeah.
So in theory, could you go to like Kaiser Medi-Cal or?
Yeah, we already applied. Yeah, applied
Okay.
to that. Applied to HealthNet, and in touch with Molina. So working on getting approved by other health plans. Absolutely.
What's the process? I mean, when you apply, what's the process like?
Yeah, so there are forms that you need to fill. So since then, I went, backwards from the, first of all, got approved by health plan, and then good people from the industry held my hand and said, Reneta, you need to join, this Sacramento Path meetings, so you can meet there all the health plans and all the clinics, and this helped me get into the mainstream, of like a Medi-Cal in Sacramento County, and their equivalent.
Oh, so there's like there's a group that meets.
Yeah, once a month. Yeah, and apparently in every county they have the groups that meet, and then you can talk directly to all the health plans that are there. So
I'm like kind of like, okay, so you almost have to do this for every plan, but for every county. So like if you want to go, so you're approved for Anthem
in
Sacramento.
But Anthem has they have a few other counties where they are available. So some of the plans, Kaiser, they're available in multiple counties. Molina, they're available in multiple counties.
Right.
So it's like a puzzle of like which health plans available where, and you just need to apply to all of them that are relevant, where you can service patients, and go through the process, get approved. And
but it sounds like one of the other keys is to go to that county.
Yeah, meeting, and then it's a good starting point where you can learn how everything works. So happy to email you later, so you'll have the resources how to sign up to this if people are interested.
No, for the blog, I'll ask you.
Yes.
I'll put that on there.
Yeah, exactly.
I'll put a link in the description.
Because it took me time to find about this, and it's like backwards after getting approved by health plan. I normally you go there when you want to start, this process, but it's hard to tell. It's hard to know. There's so much data and information out there. How will I know about this without?
So now I'm just think broader. So MedStart actually is more about it could be any kind of innovation, but it sounded like you were successful because there were already codes for it. But if there was no, like if someone creates a widget to do something, and let's say it's even FDA approved, if there isn't a code, then that's a harder battle.
If there isn't a code that can be used for a specific solution or treatment, I heard that other companies that, they paid $5 million, maybe even more, after raising, $100 million to try and figure out how to convince the health plans, doing some studies with them. And it was just a very heavy lift to create the codes. So it's much better to just go with what's existing already. It's faster. But yeah, if someone has the time and the money to create new codes, by all means, yeah.
Okay, so like my product, Humalite, it's medical food. There's studies, but there hasn't been human trials. But is this something that you think would work? Like maybe I should attend those meetings myself, or do I kind of have to wait till the clinical studies goes through and then maybe attend the meeting?
It's precious, right? So these meetings are more like for specifically, connecting between the health plans and the clinics and the providers. So if someone wants something right away, they can order, or they can start working with you, engaging. Like we're already approved, so we can start right away, and we can support patients. But if you want to come and learn, yeah, of course, you can come and learn. Now, the other thing that I wanted to share with you that I learned over there was about TA Marketplace. It's Technical Assistant Marketplace for Medi-Cal or Medicaid. And this is a place where it's a marketplace where vendors, and Clutch, by the way, is there. Rachel and their consulting company is approved by TA Marketplace, and you can hire them through this TA Marketplace and have the state pay to help set up, to help apply for health plans. I didn't know that. Yeah.
Oh,
Yeah.
so they actually have programs to help
They have
people.
programs to help, and then set up the processes. So when we started, we got approved by Anthem, they asked us, where are your processes? So we tried to do it by ourselves to build some processes, and it's not as robust as, getting like a package from a consultant. So now we're getting all of that. So we have the skeleton and the baseline, but we got approved by TA Marketplace. We got a budget of $500,000. And we have a bunch of projects. So one of them is getting all the processes in place. The other one
that $500,000, is that being paid by the state?
Yeah. Mm-hmm.
Oh, shit.
Yeah.
That's cool.
The health services, department,
So if I understand correctly, the state is paying
the
consultant to help you get on Medi-Cal.
Well, we're already on it, so they it depends on.
Or are they helping you advertise that you're on Medi-Cal?
Not advertise. The consultant is helping us establish whatever we need. Okay, so in our case, we needed to understand better the billing cycle or the revenue cycle, because we're a small team. I'm doing the billing. We're a tiny team. So, but there are other ways to do it. You can work with a company. You can work with a clearinghouse or billing providers, and there are pros and cons, and there are so many we can choose from. So they're helping us find just they consult us, give us all the solutions, and we'll decide what to do. But start with, because I started doing it myself, so I can build the processes and I'll know how all of this works. Mm-hmm. Trying to read the manual guide, the vendor guide from Anthem, I read it. I also used AI to read things. It's a very big manual. There's a lot of information there, and sometimes things are a little bit outdated and not always work. So we need to figure out how to do billing, and they have amazing staff, and they're very.
So right now, you send out your food, mm-hmm. and then you obviously have to pay your vendors.
I'm not sending my food.
I mean,
I'm eating my food. I don't share my food. No, I'm just kidding. What we're doing, the chefs, so the patients, the customers book on the platform, the chefs, and select the meals they want, and then the chefs go to their home, bring the groceries and cook at their home, or they cook and deliver them the food.
Right. So are they paying upfront and then get reimbursed?
No, I wish. So we're paying, once the service is done, we're paying, but we can bill only after they ate the food.
Oh, okay. So they go through you. Mm-hmm. They say, I have Medi-Cal, so you go ahead and pay. You have to pay the chefs. Mm-hmm. And then so you're in your rears or something, right?
Yeah. So initially I thought it would be like 2 months. I was really concerned about that. But then I found out that it's actually only 3 weeks, which is not that bad. Okay. I do billing 2 or 3 times a week. So it's like, it's an ongoing. There's some, claim rejections that I need to operate, and reach out and, hey, why was this declined? Well, please pay it. And so there is a bit of back and forth, and it's good for me to learn how this works, so I can eventually, well, our goal is to apply to IPP. Every health plan have an option to, well, I don't know how much money they have left, but they used to have budgets to support their vendors. Mm-hmm. So you can apply to get a grant to operate. Now, a lot of the medically tailored meals in our area, they got big grants, like millions of dollars. And by the time we arrived, it
was all gone.
All gone. Yeah, we got rejected from the big one, Path Sites. There was a big cycle, and we were told, no, we already invested enough in medically tailored meals. So when we got approved by Anthem, they had an option. Each health plan has an option to apply for a grant to specifically support their members. So we're working on that with a consultant too, to apply to, and they can cover 6 months of a team, and maybe rebuild some systems or build some systems that we don't have, like for billing, maybe. So they have a bunch of things that they will pay for. So we're working on that. And the other interesting thing that this consulting firm is helping us is also come up with what do we need in terms of a team? Because when I started, obviously it was like early. I I didn't know the right terminology and what's needed. Now I'm learning, but still there is a lot to uncover.
Mm-hmm.
And they know the playbook. So we'll get like the full blown, what do we need to get from here to $10 million? What kind of people, what, the team, the processes and everything. So their goal is to help us get a plan to grow to $10 million or 14, which is in our plan.
Okay. So did they so when you said you got people were rejected, did they have to be pre-approved?
Oh, they're all pre-approved, yeah.
But they still get rejected.
Yeah, different reasons. In the beginning it was my fault because I used the code of the cooking lesson for the meal, and
Oh, okay.
but that was me learning.
All right.
But now sometimes they have some internal issues. It's complicated, right? The health plans, they're billing, they're working with subcontractors, companies that do the billing for them. So it's not everything in their control.
Okay.
And sometimes people do mistakes. It's humans. It's a lot. It's very manual and labor intensive work, the billing for them.
So like the thing that you said that I was kind of concerned about is like you basically make you an offer.
Mm-hmm.
Is it offer enough to is it like really skimpy or is it enough to be okay?
Yeah, so that's a good question. So I was really worried, when I got the email from them, I was afraid to open it because I heard that the rates are very, very low. And luckily, we got the upper range of the rates, which is it's manageable. I gave them a few levels of ingredients and meals, and they selected, the mid level. So that's good. The upper level, we could even have maybe salmon, but we can't afford it now. So there's no salmon. There's much more simple, well, much more simple. Still, chicken, beef, turkey, pork, or just vegetarian, but the more expensive ingredients, we cannot use them.
Yeah.
So other health plans, I heard about, a range of different, prices. Luckily, we started with the one that we started with, and I think also I can't talk for them, but I would assume they thought it's after all like a chef would go to someone's home and it's fresh food, and it's like it is something that is different than just frozen meal delivered.
Mm.
Maybe that's why we got a reasonable amount, and it is profitable. It will be more profitable obviously when we get to scale, because now still there's a lot of
Did you have
work.
to have a dietitian put together meals?
Yeah, we worked with a dietitian to create and a doctor. So a few dietitians and a few doctors, because for nephrology we had, for kidney we have nephrology,
Mm-hmm.
for other diabetes we could work with our doctor.
So how many disease states are you working with right now?
So all the meals are diabetes friendly and heart healthy, so all of them. And then we added the kidney, and we have some. I think mostly it's the kidney that's a little bit different, and it covers majority of the people. Like people with HIV normally has also diabetes, so it's whenever we see something that we don't have, we add. So someone was supposed to be on the liquid diet. So we added not liquid, but a puree diet.
Mm-hmm.
So we added pureed meals. So we're adding as we see people come in and get approved. We're adding the.
So you contact the renal meals because I used to work on that. That's a very difficult.
It's very difficult, yeah. But we thank God for AI.
Well, it's a very difficult, because there's all these different things you have to focus on, and then
you need to meet the phosphorus levels and
exactly. And then what happens then is I can almost see it being that might be a good case study because you could see someone that I was talking to a doctor if they if someone has to do them go to the ER and do a dialysis, that's a lot of money. But if you can get some of these people that are chronically out of who have to do that, and you can get a meeting on a decent just be within parameters.
Yeah.
That could be where you could see like huge, that's where the healthcare could
save a lot of money.
Yeah, so hopefully that's kind of what I was thinking.
Yeah,
you can find a case study like that.
Yeah.
Then they'll be like sending you like, here's more customers.
Yeah, they're already sending customers, and I think it's clear. What I was initially before we started working with a nephrologist, I didn't know that you can reverse kidney disease damage. And I was surprised when she said that at a certain stage, of course, if you're already like on dialysis
Yeah.
5, you forget about this. But if you're earlier on, she saw that people changed their nutrition and they got better. It's not 100% better, but it is better. Yeah, and there are stages there. You have a kidney disease stage 2, 3A, 3B, 4, and 5. So
How long have you been doing this so far?
about a year and a half.
Have you seen any, like, that would be like a great case study, like,
Oh, the kidney we just started, but
oh yeah, that would be,
just
because
launched.
that was kind of what I was
Yeah,
focused
yeah,
on
yeah.
for a while.
Yeah, we started servicing patients just in March, which
Mhm.
now we're in July. So all of this is not long, and the kidney
Yeah.
is just very, very new.
That's a huge one. If you can you can show, like, you'll have 1 or 2 case studies where, here's this guy that's like a 3 and you actually got him off dialysis.
Yeah,
That's money.
yeah,
That's like,
yeah.
that's a huge saving.
Typical, yeah.
And there's a big toggle between the 3 steps of kidney disease and dialysis and transplant. And
Yeah. Oh,
they
yeah.
add zeros every time you
Oh,
move that,
gosh,
right?
of course, yeah, yeah.
Yeah.
Yeah,
Okay.
so my dream is really to have some research done on this and
Well, there's
potentially.
studies, but then you can just get, like just one case studies. Like, there's research. I was kind of, and I realized that's a headache. But if you could just get like one person and
Just one story. So there is actually, an effort in California to connect all the health systems and providers and have all the data aggregated in one system. It's called DXF. And they're going to have grants too, by the way, for you if you wanna tap into this. But and they're going to support also studies where if you're doing something you want to track, the progress and patients, progress. So this is on our roadmap for next year to see how we can tap into this data, and along with the patients or the customers we're servicing that are Medi-Cal.
you should. It's too bad Dr. Curate he just left like 2 weeks ago. But since Ashita, he could have just referred patients that fit the parameter. Maybe when he gets back.
Yeah.
Or I'll talk to him.
Thank
I'm
you.
supposed to talk to him and see if
that would be amazing. Yeah.
But especially if you get.
So actually, we got a letter of support from Sutter, and we're in final stages, going through their compliance team to start referring to us patients, Medi-Cal patients, so kidney, in addition to any patient. And they have a group that's very interested, to start working with us. They do see and support Medi-Cal patients. It's not everyone. We need to find the right pockets of. They have 1 million Medi-Cal patients, but where are they? You won't find them in Folsom here, in the facilities that, or in the clinics here. They're in specific places. So we're identified the areas where we can service them.
I mean, it's easy to find dialysis patients because they're at the dialysis centers.
Well, we're getting inbound referrals and just word of mouth. Yeah.
From that dialysis center, it's almost like they've gone too far down the continuum for a collaboration, because now they're at a certain point where, DaVita is probably, they're going to have that, but
so
you can't get them off the dialysis.
No, but even if they're on dialysis, because they still need to be on the diet.
Yeah. Oh yeah.
Yeah, and if they're off without the parameters, it's bad. So and what's worse is if they have to have I think what Dr. Trey was saying, like, is over the weekend. Like, if you're doing Monday, Wednesday, Friday, you're kind of okay. Like, you go there and have that, but then that weekend it becomes bad. And then if they are like out of compliance, then they have to go to emergency dialysis, and the ER doctor said like that's astronomical expensive. So
someone is at the door.
So we're just having a discussion. So we'll grab the chair over here.
Yeah, sorry I'm late. I thought you guys were at Ag's.
Yeah, no worries. Yeah, good.
With Ag's.
So yeah, like I think even within like even if they're on dialysis, I mean, I almost think anyone that is on dialysis is a customer because it is such a hard diet to manage.
I agree. I can say that people that are diabetic or have some heart conditions, you can absolutely improve and reverse with nutrition, a lot of those. So and 60% of Americans have one or more chronic condition. Majority is the diabetes and heart. So kidney, I think it's about the doctor I was working with, she said I think 10%, 12%. So it is very big too.
Yeah, but it has such a profound effect. Dialysis is
Sure.
not cheap,
Yeah.
and it's such a
Yeah.
I mean, a bummer is kind of an understatement to have to
And
go on
it's
dialysis.
normally, by the way, the kidney damage is happening to people with diabetes.
Right.
So it's all like progressive.
Yes, that's exactly true.
Yeah.
It's a progressive disease.
Yeah. So if you can help prevent it, or at least stop the downhill, and then help reverse it. You know what? I'll tell you even something more interesting. I tell people with diabetes, there's so many symptoms, and the result of diabetes is so difficult on the body. One of the issues is losing eyesight, and having, of course, all the sores on the body, and then amputation, heart condition,
renal disease.
And then when do they start to eat broccoli and healthy food? When they find out that men can have also ED, and it's unreversible. They don't care about the dialysis, but if the ED is there to stay because of nerve damage, now they're going to eat healthy. So you have 5 years window for people with the type 2 diabetes, or up to approximately. After 5 years, it's unreversible damage. So yeah, exactly. Yeah.
So
eat your healthy food.
So so if your advice, and I'm just, I'm trying to go maybe even broader, but to get approved, because there's companies like, startups like you that have food, but then there's, you have like a medical robot, or some, I know a couple of startups that have some sort of devices. And let's just say theoretically they pass all the FDA stuff. For them to get, what's your advice for them to get approved by? Actually, first of all, is if let's say it was something like that, it sounds like the first thing to do is HSA, FSA.
Yeah.
That seems like a lower barrier.
You can go to my summary with a short summary of what to do.
Okay.
Be persistent, tell everyone what you need, and meet with people like there are in health in different stages. So those that are already, because it can be very different for a hardware solution versus meals or medicine. Even with the FSA, HSA, they have it's a different story. If you're like actually FDA approved, you don't need to go through them. But I don't understand in this space that much. So I think the important thing is my advice is to get out, come to meetings like this, meet founders and experts in different stages, so you can learn from each other. That's the best place. And then go to places where there are mentors and advisors. And I got so much help, and I'm myself now happy to help others. All you need is just the right angel at the right time to make the right connection, and then magic happens from that.
Yeah, you have to keep knocking on those doors.
And that's the other short version, there is no, you keep on going, and there's not yet, or there's yes. There's no other option.
So now that you've kind of gone through this barrier, has been any interest from VCs at all? I mean, I remember you talking about if you crack this code.
I don't know if this is a big topic. I don't know if it's for this meeting and discussion, but what I've been seeing is an interesting thing. I've been seeing, I raised so far a little over $500,000 over the time, but I noticed that I'm getting this, the line is constantly moving of the expectations. And I met with some investors, and I thought initially, okay, I need to build a relationship and trust and show them that I'm progressing, and then we have traction, and then the investment will come. and then administration changed, and crazy cuts in Medicaid, were hoovering and were approved. They're not going to cut medically tailored meals, but I did lose investors because of that. So that sucked. But we keep on working, and it's like a medicine. It's not food insecurity, but investors, it doesn't matter. Once they're scared, and they're out. So that was one thing. And the other thing, like I mentioned, the line kept on moving, and at some point, it's really hard to show the growth and the traction without getting the funding. So it's a call for investors. If you see something that you like, just go and support. We were told when we got the letter of support from Anthem back in 2023, in November or something, we applied, and they gave us a letter of support so we can apply for a grant. And then I showed it to investors, and they said, no, we want to see that they approve it and what rates you're going to get. So we got the rates in July. No, we want to see that they signed the contract. Okay, from July, they signed the contract, but we need to pay the bills. And then after we signed the contract, then the milestone again moved. No, now we want to see after the first 10 patients go through. And then after that, no, we want to see the 1,000. We get into funding to get the 1,000.
Are you really serious, or are you just making excuses at this point?
I don't know what to tell you, but I'm not sitting and waiting for anyone. Of course, keep on operating and being. We did some changes to get to profitability, and making some other internal changes just to be able to keep on growing. But it's been a challenge. The fundraising has been a big challenge, and can be different amount of reasons. Maybe if it wasn't recession and the administration didn't change, and I was a white male from Stanford, and there were unicorns and rainbows behind me. I don't know, maybe I could raise $10 million. I don't know to tell. But the bottom line is that it's been very challenging for different reasons, very challenging.
That kicking the can feels like the dark side of there is no no. There's not yet.
Yeah.
It's just a little out there.
Yeah. So actually within investors, I have only yes. Anything that's different than a yes is a no.
Mm-hmm.
It's basically not serious.
Yeah.
And of course, I'm sending investor updates, I'm maintaining relationship, but I'm not counting. It's not money in the bank until it's a yes, and the wire is transferred, and 3 days passed, and they didn't cancel the transfer. Only then. So fundraising haven't been easy.
And I've talking to Dr. Crate after the new administration came in, and he's going over to Columbia. He said that, he's actually talking to people that are right in the middle of research, and the funding was shut off, and he talked to one person that was doing, in the middle of research, and she said she had to lay off 2 of her lab assistants, and she may not have anything to do. It was like they just turned off the spigot. So
on our side, everything is normal, and there are changes coming. So we're tracking it with SACPath, or this organization that I told you guys about. So they have a person that tracks all the progress and the changes that are coming, and provides some interpretation or perspective of what to expect. So at least we know we'll have a
with the big beautiful bill. Is that going to cut off a lot of? I mean, we heard it's going to cut off a lot of people, but
so it depends on how they're going to implement that in Medi-Cal. So the main changes is that or at least from my understanding, is that the federal funding is going to go from 60% to 50%, and then the state will have to fund more. So far, the state was 40%; they will have to increase. So it's a state problem too. How do they get the funding, and what will they fund? And then there are additional. Some of the members will have to work at least 80 hours to qualify. So you have people dropping from Medi-Cal, and you have less people covered by Medi-Cal because they won't, or Medicaid, if they don't meet the work or volunteer requirements. And there are a bunch of other changes like that. So that's supposed to help drive the cost reductions. Now, I did read somewhere some information about specific programs like, SNAP and other programs that are more food insecurity that probably will be gone. but I didn't see anything specific
For Medi-Cal.
about food as medicine or the medically tailored
Well,
meals.
that's good to hear.
Yeah, and we're diversifying, so working with just Medi-Cal or Medicaid patients. It's one egg in the basket, and it's always good. When I worked at Intel, always diversify.
Mm-hmm.
So having self-insured plans, self-insured employers, commercial health plans. This is also guidance that I got from Dr. David Lubarsky, that is involved in a lot of discussions, and I verified with him, hey, should I continue doing that? And his advice was there is enough other areas as well to grow and to diversify and to de-risk, this kind of risk. So I'm doing that too.
Okay. You guys have any other questions?
Let me formulate this. Because it does seem if the CPT codes already existed in the Medi-Cal system, does the commercial side use the same, ICD-9 code, and do they actually assign those, or is that just another open door that you need to go knock on?
Yeah, so that's a very good question. So another thing that I'm doing in my space that I would recommend doing, I just reached out to all the competitors, and with some of the competitors we actually became partners, so I'm learning from them. Some of the bigger ones, the national ones, I did speak with them. We're not partnering, but I did learn from them that they do have commercial health plans. They didn't share codes, so I don't know yet until we actually get approved and get in. So that's still work in progress.
Is the big one like Mom's Meals?
Yeah.
Okay.
Yeah, I didn't speak with them. So there was another one that mentioned, got in touch because I'm trying to learn from those that are in scale. What do they do? They don't always tell you everything because, competitors after all. But I always look at those big companies as potential acquisition, or but there's a potential relationship here, or we can learn and help each other because we're not doing the pure delivery like them with the frozen meals. We're very different. And some are actually referring to us patients because, we're like, some patients want in-home, and if someone wants delivery where we're not servicing or we don't have chefs in that area, then we just send to a meal delivery that we partner with. We did it with Burgess Brothers and Our Food X. So that's working really, really good. Yeah. So I strongly suggest doing that and then learning from them, and we're helping them and learning together new things.
Because I think once the fact that you already have approvals with Anthem, you know that works, I bet it's just asking a question of...
Oh, no. It's a different company. I tried.
Yeah, they're
completely different. I wish it was as simple as asking a question. I asked the question. Every person I talked to with Anthem, and they're like, "Oh, I don't know. That's a completely different,
So you can't go to insurance.
You start from zero.
Let me look at my Rolodex.
I would love to. Thank you. Oh, here we go. Here is an example. I need help. Yeah.
So, when you start looking at ecosystem, individual, family, small group, large group, they're all different ecosystems. Yeah. The self-funded space and jumbo employers is a different space. Yeah. There are TPAs that rent networks, and they'll do Anthem Shield and rent that network and apply it to a health plan. But the root of how do they administer medicine and approve claims is pretty much the same.
True, yeah.
And they don't have, I'm going to say cookie cutter, because they do have a style of how they say this makes sense medically to then move on. And, the fact that you've got regular applications in that one space, it probably means it applies to every other space as well.
True.
Because we're just taking care of humans, and they all generally have the same conditions.
So is that kind of your... sorry.
Yeah.
No, I was thinking, is that your plan? So you got Anthem, Medi-Cal, Sacramento. I don't know. Let's just say, I don't know, Blue Cross. I don't know if there is such a thing, but insurance ex Sacramento.
Anthem, Blue Cross, yeah.
Yeah, well,
No, they're Anthem.
he's saying, so like
Another
Shield or
another
United,
insurance company.
Yeah.
So like let's say there's 4 insurance companies. You've got Anthem,
Mhm.
and there's just 3 other insurance.
Oh, there's Molina, HealthNet, and Kaiser. Yeah,
So you have to then it's like you're starting from ground zero,
ground zero.
and you've got to figure out who.
Yeah.
Um,
Even when I have already the contacts. I ran the same playbook on others. It's hard. Takes long time.
and I think that's a separation between the Medi-Cal space
And the commercial.
space. Because yes, in the commercial space, they get approvals by county, but it's very much an umbrella that sits over the state.
Mhm.
And it's the state Department of Insurance that governs it. Whereas you're making connections with, regional, local clinics that are then connecting you to their provider.
oh
No. When we got the contract from Anthem, it's with Anthem. It's not the clinic.
no, but they made the introduction though, right?
It's just in this case, that's how I got in.
Right.
Like normally you don't need to go in this path. You can go straight and apply to the health plan and then say, hey, we want all of these areas. Anthem specifically preferred to start with one area where to make sure it's working well, and then we can expand.
So so you can't. It wasn't easy. You can't. It sounds like you haven't been successful getting to the other insurance companies like Kaiser, Molina.
We're in process with
So, but you're in the application process.
different stages of the application. Yeah.
Okay, so that's good. You're making progress.
Fine. Yeah. Mhm.
You're making progress. So once you get all of them, then you're really good in Sacramento.
Mhm.
Then you got
Sacramento has 500,000 Medi-Cal patients, and then across California there are about 15 million. So LA is the big one, and LA is very competitive. And in LA there are some big vendors. So it's interesting. We'll see. We'll see.
Why don't you stay in the greenfield and go for the areas that are not serviced?
Yeah, that's an option too. Yeah, go ahead.
I did have a question. Sorry if I missed this earlier.
No.
So what, would you say, like top 3 things you're pitching to an insurance company on your service?
Mhm.
What are the things, because like you're going in for a loan, you have to do financial projections and in hand kind of your financial statements. What are some of those things from your perspective for insurance companies?
Yeah, you don't provide your financial statements to the insurance company. You just apply to become a
but
vendor.
I mean,
Yeah.
Top 3 things you gotta have ready in your sort of.
And then you just fill a form. Fill a form about your services, and then if they have a need in that area, and in some areas, like for example, they have so many vendors they don't take any more vendors for specific areas. But if they don't have enough, then they invite you, and then they ask you to fill more information, a bigger application, and then you just provide them the information. So you have to have processes ready to show them the pricing that you want to offer. That's what you're asking for, of course. And then the processes, pricing, of course, the service itself, what does it include, all the information about that. And then they will review all of this. Will take a few months and then come back to you with an offer, like what do they agree to pay. Now, if you're a nationwide company and with strong presence, maybe you can negotiate with them. I don't know. I heard it sounds for me like a dream.
Mhm.
But when you're starting, your first one, definitely they couldn't negotiate it and just took it.
So what's the reimbursement? So let's say you have a customer.
Mhm.
I mean, they're pre-approved. They contact you. We want
Mhm.
Reno meals. So what's the whole reimbursement process like from there?
And so they book the chef. We normally ask for at least 4 days in advance for the first time, and after that, so we help the patients make the reservation, 6 reservations for the duration of the 12 weeks of the authorization, and then throughout this 12 weeks, they will get a lunch and dinner every day. So the chef comes every other week, cooks for them food for 2 weeks, 1 week in the refrigerator, 1 week in the freezer. That's the flow.
You have little containers or something?
Yeah, we
Okay.
provide the containers too. So the patient or the customer, after they select their meals for the first one, the chef will go provide them the food, and then we can bill only after. You can't bill before. So
after the service
has been after not completed, but after they ate the food. So it's for a duration of 2 weeks.
The medicine has been administered.
The medicine has been,
exactly. So you have to if it's 2 weeks, you have to wait till the 2 week.
I can do every day, and every day I can bill for the first day, second day, third day. I do it twice a week or so.
Okay.
Yeah, yes, it's crazy. I have a crazy Excel trying. Can't wait until the advisors will help me with something more, sustainable because it's like a little bit more growth and with cash. My Excel will crash.
Okay, so you
And
basically
then, yeah, the other thing as well, yeah, and so the
does the patient have to say like, oh, I check marked it or something, or
no, it's only the chef that marks complete, and then we know that it was provided, the meals were provided.
but you have to do it after it's consumed.
Yes. So, and then we wait after that. I'm waiting a week after, and then I apply for the previous week, and then another week and apply for the previous week.
Really?
Or I'm billing for them, yeah.
Oh, the payment.
And then it takes another 8 days to get the payment. So
Oh.
about 2 to 3 weeks is the cycle.
Yeah.
Okay, well that's better than like 2 months.
Yeah, exactly. Initially I was really worried, but now I'm just medium worried.
Medium worried.
Hope one day I will be not worried. But
No, but it's just an invoice. You send it. Do you have
we
to,
go through their system. So we're using a platform called Ability that Anthem uses. I saw that a few other health plans are using Ability. So I learned how to use it. It's it's a system, has its pluses and minuses. At least it's a system. You don't need to send emails and God knows how to track.
or
At least in
fax? Send a fax.
Talking about fax. So the authorizations we're getting in a fax. Yeah, and that's instead of sending us like snail mail, because I'm renting a mailbox and I didn't want it to get bombarded. One day you come, you see a bag of authorizations. I'm like, can we do something different? And they said, yeah, we can use a fax. So we established of course, electronic fax. It's online. So I'm getting it by email, but also it's something interesting. How do we transfer the data to, still didn't figure out all of that. The health system started too. They want to submit the referrals by fax. So I don't know. I need to find a solution.
Do you have to worry about like HIPAA compliance at all?
Yeah, it's all HIPAA compliant.
I mean,
Fax service is HIPAA compliant.
But do you have to have a platform
Of course, everything.
You have a
patient information is on a HIPAA compliant server.
right. So are you using their information, or do you have your own like Epic whatever?
And no, we're not using Epic, so we use their Ability. But we do get like, referrals, and the referrals include medical information. So all the referrals are landing on a HIPAA compliant server. And then all the chefs go through like our team too, and the chefs go through HIPAA compliant certification training, and they get certification.
Wow.
Yeah. So I had to learn how to do that as well. Yeah.
So your system's like an extension of the insurance company's system, like you're somewhat?
Extension, we're plugging into them. It's not very efficient, so I am like thinking how we can optimize this, especially
Are you paying for the license for whatever the product or whatever that CRM is, or okay?
It's more everything that's HIPAA compliant is more expensive.
Of course, yeah.
Like First Disk is more expensive. Jot form is more like anything you touch that you need to be HIPAA compliant is more expensive. So that's why Anthem offers those grants to help new vendors pay for some of those until the profits kick in from the program, and then we can finally accumulate enough revenue to operate.
And I see Anthem has a lot of liability if there's a vendor that's not compliant. They probably have more liability than you do.
Mm-hmm.
No, it's true.
Yeah. We don't. I don't save the blood work, or I do have access to some of those, but it's all like on their side, and of course we're checked, and they did verification on all our team and whoever has access to their system. So yeah, they're very careful with that.
And I do know how I want to introduce you to. So.
Thank you so much. Amazing. Here, live. We see how this works. Always say what you need.
And actually, next month, Dr. Larry Orzan he's going to talk about HIPAA compliance. So.
Oh, perfect. That's what I needed a while ago when we just started. Eventually, I have some resources also for HIPAA compliance. So happy to share a company that does. I learned it from another startup that does cooking lessons in person, but like in a kitchen. So not going into people's homes, but in the opposite of what we're doing. Mm-hmm. And they shared with us their vendor for certification and what need to be done. So it wasn't very expensive. It was just a few thousands of dollars just to go through all of it.
And so that they provide like compliance services, audits, etc.
Exactly. Yeah.
Do you get audited? Or have you gotten audited?
Just started.
Okay.
We do provide reports when needed. So I just submitted our first report like this month because it's the first time, first quarter.
Yeah.
So
Like internal audits just to keep up with.
we just started. There isn't a lot
Yeah.
going on anyway. It's like just literally like 3 people doing it, and we're talking all day. It's like the auditing is in the way we're. Yeah, if we're bigger, of course.
When you think about designing the service where you're introducing it, you're gonna just keeping that in mind, like having that compliant service.
Yeah, of course.
That's what I meant.
Yeah. Normally the
So your
way.
processes.
Mhm.
Also, well, so.
Absolutely, yeah, absolutely. And normally the way we look in startups is like we tackle what's about to kill us now, and then or what do we need to progress? I'm a very positive person, but this is a startup.
Positively tackle the thing that gets about to kill you.
Just right here in front of me, because if I tackle something that's ahead of me in a year, I'm gonna die by then. So yeah, of course, we'll get to everything, the processes, the bigger processes, and also some other follow-ups with the patients, which is very difficult. We didn't figure out that yet, just to see, just to get feedback on the meals and on the chefs, and so we are getting one-on-one when we're helping them book the meals, but it's a different Medi-Cal population is different than employees. There are many of them don't use email, or they don't respond that well on text messages. It's a different population. So sending them text messages, hey, so give me feedback, fill this form. On the consumer side, we have also a consumer platform where people pay out of pocket for chef services. We do have people fill their feedback, and it's super helpful. Even there, it's like a small percentage. So I don't know yet how to do it. So that's one of the things that we need to do, and I don't know yet. But
Cross that bridge when you get there.
yeah, first of all, let's make sure we provide the service, we're getting paid, we keep the lights on.
Yeah.
And we're lucky to see a few more, days, weeks, months.
I know.
Yeah.
I hear you.
Help a few more patients, and then the reason we're doing this is really to help people just live healthier.
Yeah.
And I'm happy to see that we're already helping a lot of people, which is awesome.
I think it's great. You're doing a fantastic job, Reneta.
Thank you. Thank you so much.
So anything else? Should we wrap up?
Yeah.
All right. Well, thank you for coming today. And we'll have this video out, and we'll have a blog, and hopefully you'll get some traffic from that as well. But thank you. I learned a lot myself personally, and I might actually have to pin you up. And I think glad Justin here. I love you, Justin. He's a regular. He always comes. So
yeah. That's awesome. Yeah, I didn't feel like I shared, some new things, but I'm happy that it helped
you shared a lot. Like right off the bat, FSH, HSA is just a API plus some sort of approval process. Okay, we can do that.
Yeah. It took me a long time to find it, like months and months that I was looking.
Yeah, I'm gonna actually look into that. I mean, amongst my other things, I have my non-paying stuff, and then I have the stuff that actually pays money. So. I'll have to put that in. So I'm going to check that out and see if we can get FSA or HSA to pay for it.
Yeah.
All right. Well, so I can tell you about who I'd like to share with you. So Kathy Martella, she was the executive director at Aetna. She was there for 36 years.
Wow.
And 6 years ago moved to Anthem as their basically general manager of commercial business for California.
Holy guacamole.
So
they said I'm living a curse. So
guacamole.
So she sounds like a good person to talk to.
Oh yeah.
I think, my understanding, if I can say, hey, we're basically treating chronic conditions through nutrition, and it's something that Anthem on the state platforms has already supported. And I think there's probably already a spot for this in the commercial market. Can you direct us on who the right people to talk to are? Does that sound about right?
Sounds amazing. Yes.
Okay. Yeah. So I'll do that.
Amazing. Thank you. Wow.
And it's funny how I've gone through these hoops with carriers in the past. We had this program, maybe it was 10 years ago, that we put together, and we needed we needed a network and we wanted to use Anthem's network, and we're working through a TPA, and they're like, well, we got to go through these hoops and get all these approvals. And then I realized all of the hoops that they're going through. I'm like, wait, you mean I just need to call Roger and tell him to tell these people that? And
That's funny.
and so it's like we already know the people, and we're trying to jump through all these process hoops, and they're trying to get back to somebody who will answer my phone call.
It's amazing. Wow.
And so sometimes that, and I found that when you can ask somebody, can you give me a little direction, that usually they're happy to.
100%.
So
100%. And if they're really passionate about a certain space, they will get even invested a little bit more. That's what I see with when community help happen. Exactly that. Yeah, you're absolutely right. Yeah.